Bismillahirrahmanirrahim. Assalamu alaikum. Today we shall discuss the very interesting aspect of the management of steatotic liver disease. That is the best practices in the management of steatotic liver disease. In this series of discussion on steatotic liver disease, we learned the new terminology introduced by AASLD on 24th June. Then we discussed the definition and what happens in the steatotic liver disease, what is the pathophysiology and what is the clinico-pathological correlation of this disease. Then we discussed the pathophysiology of steatotic liver disease, and we learned that in the presence of the genetic disposition most of the times, and in the glucotoxicity and the lipotoxicity, both of these leads to insulin resistance, and the insulin resistance leads to the liver becoming steatotic or fatty, and then the insulin resistance, other manifestation, the fat deposition in the rest of the body also happens, and then there is obesity leading to pre-diabetes and diabetic state. Today we are discussing that what should be the best treatment options or best managements in the fatty liver disease patients. So, as I said, today's discussion topic is current best practices in the steatotic liver disease. What is this? This is different people sitting around a table, involved in a discussion, and everyone giving its input. This is called holistic approach. That everyone is involved in taking care of something. And if this something is fatty liver, so everyone is putting its best, its part in its care, as well as the liver is not taken in isolation. The whole individual is taken into consideration. This is the holistic approach. So, today I shall be just touching on the core concepts. I'll give you the core concepts of holistic approach in the fatty liver disease or steatotic liver disease, and making my point that this is the current best practices. We know the new terminology which has been published on 24th June 2023, and this metabolic dysfunction associated steatotic liver disease, or the MASH, which is the most concerned one. Previously it used to be called NASH. When we see a patient with MASH, believe me, this is the tip of the iceberg. This is the tip of the iceberg. So any patient with fatty liver, don't forget that there's a metabolic syndrome. So fatty liver is just one of the manifestations of the metabolic syndrome, whether that has been obvious or not, but this is the tip of the iceberg. This is the metabolic syndrome, and you have found one feature of that. And we discussed this in the first slide, that this is the 5 criteria for metabolic syndrome: BMI or waist circumference, diabetes, hypertension, high triglyceride levels, and low HDL levels. In the absence of the fatty liver, you need 3 out of these 5 to label that patient as having metabolic syndrome. But if the patient has got fatty liver, You need only one criteria of these 5. And now this will be the diagnosis of metabolic syndrome. So when a fatty liver comes to you, whether the patient is symptomatic or not, this is your responsibility to establish, to look for the other features of metabolic syndrome and make the diagnosis of metabolic syndrome. Because the metabolic syndrome, this is the one, fatty liver disease is one feature. There may be lipid problems, is high triglyceride levels or low HDL levels. The patients may have hypertension, diabetes, cancers, dementias, heart diseases, polycystic ovarian syndrome. So this is one of the presentation or one of the features of the metabolic syndrome, and do look for other features of this metabolic syndrome. Metabolic syndrome, we know this is the insulin resistance, and insulin resistance is characterized by fatty liver. Which comes first? I give the idea or the school of, I discussed with you the hypothesis or the new thinking that this is the fatty liver which comes first. Liver becomes fatty. The insulin resistance, when starts, it makes the liver fatty, and then it further increases the insulin resistance. It goes on, and then all these features come. So the NAFL or the fatty liver disease, it has got all these features: psoriasis, liver-related complications, malignancies, osteoporosis, sleep apnea, type 2 diabetes, cardiovascular disease, cardiac abnormalities or arrhythmias, chronic kidney disease, polycystic ovary syndrome, psoriasis, or liver-related complications. So the NAFL or the NASH does have other features, and that the patient who has got the NASH or NAFL or MAFLD or MASLD, that patient has got other features like liver-related complications, malignancies, osteoporosis. The patient may have sleep apnea, abdominal obesity, type 2 diabetes, cardiovascular disease, cardiac abnormalities including arrhythmias, chronic kidney disease, polycystic ovary syndrome, and psoriasis. So all these, 1, 2 or more of these features will be present in the patients with fatty liver disease, and this is important that we should be looking for that. So the current best practices in the steatotic liver disease includes look into the past, evaluate the present, and then predict the future. So this is very important when a patient comes to you with fatty liver disease. Does take the history of family history of diabetes, hypertension, sudden cardiac deaths, dyslipidemias, are all these events are the features which I have discussed with you. Also ask from the patient whether he is diabetic, he is hypertensive, ever he has checked his lipid levels. And then with that history, evaluate the patient fully for all these possible features, and then you plan that, okay, what complications of the metabolic syndrome are present in the patient, what next to come, and how to prevent that. So the best practices in the steatotic liver disease will be treat the MASH, which used to be called NASH, look and treat liver-specific complications. This is all important because you are a hepatologist, you are giving care of the liver, so you need to look and treat liver-specific complications. And of course, you will look for and treat comorbidities like other features of the metabolic syndrome. If those are present, you will treat that. And you will offer this patient primary prophylaxis and secondary prophylaxis of all these features. So holistic approach is required in that patient. Of course, the liver-specific treatment or the steatotic liver disease treatment is lifestyle interventions. That is the weight loss. The patient should lose 10% of the body weight over next 6 months, and it helps the steatosis and other bad features of this steatohepatitis. The diet, it should be low carb, low fat diet, and exercise at least 30 to 45 minutes exercise, aerobic exercises 5 days a week is very, very important, beneficial to lower down the fat content. Different medicines have been used by the people, the vitamin A, pioglitazone, GLP-1 receptor agonist, ursodeoxycholic acids, obticolic acids, with not the variable success rates. Still, believe me, there is no specific drug available for steatohepatitis to help on. What we should do and what is required is the weight loss, diet, and exercise in the healthy lifestyle adoption. So, dear colleagues, this is the currently available best managements for steatotic liver disease. We need to adopt the holistic approach. We need to not concentrate only on the fatty liver, but the patient as a whole. And if a patient presents to you with the fatty liver disease, this is the metabolic syndrome which the patient has presented to you. This is now your responsibility to look for the other components of the metabolic syndrome, and if present, treat those as well. And if not present, you prevent the complications of those to happen. Of course, in this way, you will need the help of your colleagues, your diabetologist, your nutritionist, your cardiologist, your interventional cardiologist. Even you may need help of your surgeons, help of your endoscopist with the endotherapy, endoscopic balloon therapy, or other endoscopic bariatric therapies, or even the surgical help for bariatric surgeries. So it is a teamwork, as well as a patient should be taken as a whole, not only isolated the fatty liver disease. So I stop here. I hope that in these 4 videos, I was able to give you the current concepts and updates on the steatotic liver disease. What is it? What's the new terminology? What's the pathophysiology? What is the pathology? What is the pathophysiological or clinical pathological correlations? And what should be the best approach, holistic approach to treat these patients? I stop here, and inshallah we'll meet in some other discussion in another video. Till then, Khuda Hafiz.